Magic mushrooms and other psychedelics have emerged as an alternative approach to treating a variety of mental illnesses, including PTSD and treatment-resistant depression.
Circle of Health reporter Denise Dedore has a story of one family medicine physician who's on a mission to make these types of therapies available.
Ketamine, magic mushrooms, MDMA, different forms of psychedelics.
Psychedelic refers to a compound or substance that can alter our perception, our mood, and our consciousness.
After 15 years in family medicine, Dr. April Soto decided to open her own practice after working on her own mental health.
I had major trauma as a child.
Fear and dread led to insomnia. Talking to a psychologist and meditation helped, but Dr. Soto experienced even deeper healing with psychedelic therapy.
I have used ketamine in my own life so that I could heal from things that happened to me.
Now she's helping patients like Pilates instructor Louisa Frias reduce her anxiety.
You can overthink and over-worry, and it's very tiring to have that chatter always in your mind.
A psychedelic journey with ketamine can take 3 to 4 hours. The recommended protocol is 3 sessions.
I ask questions and I'm meticulous about making sure that it's safe and appropriate for that particular person. And then the journey is scheduled for another day.
Ketamine can be given intravenously or sublingually. Patients lay down under blankets. The compound accesses certain brain receptors.
And it can lower our defenses so that then we can sit with things that we need to sit with.
Once the ketamine is administered, Dr. Soto is Louisa's guide. But unlike a talk therapy session, much of the healing comes through self-talk.
It's a total perspective shift. And I did realize everything I need is within myself.
Although magic is in the name of one psychedelic drug, it's not magic. Dr. Soto and Louisa say hallucinogens are tools to help people connect with their emotions.
It is important to have a therapist to talk to after.
Magic mushrooms and MDMA can only be used in clinical trials, while ketamine use is legal. And while more research and regulation is in the works, Dr. Soto sees psychedelic therapy as a growing movement.
Primary care plus psychedelics is going to be mainstream in about 5 years.
It's not covered by insurance. An evaluation can cost between $300 to $500, and treatment ranges from $600 to $1,500. For Louisa, one was enough to give her the perspective she needed.
I just wanted to try it, and it's definitely been life-changing for me.
In Pasadena, Denise Dedore, ABC 7 Eyewitness News.
Hello, I'm Mark Brown. Get more great ABC 7 content by clicking the subscribe button for our YouTube channel. And download the ABC 7 Los Angeles streaming app on Fire TV, Android TV, Apple TV, and Roku to watch on your TV.